Okay. Hi, and welcome to our segment, our webinar on Ask the Vet with Dr. Tom Tully. Welcome, Dr. Tully.
Well, thank you, Laura. Glad to be back. It was just a few weeks ago. It was Halloween, and
You
now
know, I was just noticing that as well, that we had you last on Halloween, and now we have you back on Friday the 13th. So we're going,
there you go. I didn't even realize that,
yeah, so we're
So
going with the theme here at the just like scary.
yeah. Well, it continues, right? Well, Halloween will be here before we know it. So there you go.
That's true. That's true. Yeah, so we were just we're back at it. I'm sure we've got a lot of nice, interesting questions today. Let's see. Let's give people a minute to log on, make sure we get our audience, everyone together here before we dive into our first question. Dr. Tully, we were just talking a minute ago while we were prepping for this. Some of the telltale signs of if you're in a room full of vets, how do you know how do you spot the avian, how do you spot the avian veterinarian in a room full of veterinarians that are dog and cat?
Oh, well, yeah. Well, I mean, we were talking, it says like when you usually trim a bird's claws, you'll have bleeding occur because they're claws, they're not nails. And this occurs a little bit more in younger birds than older birds, and it just depends on how much you need to trim. But if you do have bleeding occur, we use silver nitrate. And the silver nitrate comes with a long wooden stick, and then on the end is the silver nitrate. It works really well because you can actually activate it as soon as you touch the bleeding. Well, when you activate it, it goes from being kind of a solid substance on the tip of the wooden stick to more of a liquefied. Well, if you're trying to get the blood stopped, and then all of a sudden, what happens is that you get a little bit of the silver nitrate on your finger, and so you don't notice it initially, but this helps stop the bleeding, but at the same time, you don't notice anything initially, but then the next day you have all of these kind of black stains on your hand, your fingernail. If it's on your fingernail, it'll be there longer. I think I still have some here on my fingernail that I'm looking, I don't know if you can. No, I don't.
Oh yeah, see,
There you go.
yeah.
And so it's just, I said, well, how do you tell? I said that's just a rite of passage if you're a veterinary nurse or a technician or veterinarian. And well, and Laura wanted to know, could I find the avian veterinarians if I'm speaking to them? I said yes. Well, they just show you your hands, and if you have black stains, you're an avian veterinarian. It's just part of the process there.
That's fine. It comes to the territory.
Yes,
That's
it does.
awesome.
Yes, it does.
All right. Well, I think so. If you're just joining us, we're with you're at the Ask the Vet with Dr. Tom Tully webinar, I guess we already. So if you have a question, just to remind you to please use the Q&A button feature and not the chat feature, so we can capture the question and let's go from there. Okay. Oh, and I'm sorry, before I move on, I do need to remind everybody or announce that we are going to give away another product giveaway this webinar. It's going to be a 4-pound bag of the tropical fruit pellets, and also the lucky winner can also choose another Lafeber product that their bird likes. So,
all right. That's great.
Yeah, so I look forward to that. Okay.
Had a little conure come in today, and a little sun conure. And so I saw him in his little carrier, and I said, "Oh, I think this little bird needs some nutriberries." And so put the nutriberries in there, and hopefully it made his veterinary visit a lot more pleasant. And went right after him. So good products. Good products.
Oh, that's tender. It's kind of like getting the treasure chest when you went to the dentist as a little kid.
Yes,
Exactly.
There we go. Exactly.
So, okay, I have a question. I have actually two questions from Frank. He says that my 3.5-year-old blue front Amazon barbers a 1-inch patch near each wing. Is there a way to stop this behavior? And then his second question is, he has an 8-year-old female Caique that has a bald spot under the neck feathers, and he wants to know if this is a medical concern.
Okay, the Amazon question, how old was the Amazon? Like a
3.5.
3.5-year-old Amazon, and barbers its wing feathers, correct?
Yeah, it's like a 1-inch patch near each wing. So
near each wing. The one thing that you're looking at here is that when we see this, you have symmetrical, you have feather destructive behavior in a certain area that for the most part there's usually when it's more generalized, it's not something that's kind of focal, which may be where we go back to the Caique. So we'll talk about that a little bit. But with this, this is a condition that it very possibly could be behavior. And then when you're looking at behavior, you're saying, well, what kind of behavior would that be associated with? It could be associated with frustration because you have to try to think a little bit about what would cause the bird to actually do this. Is it kind of frustration because it doesn't have anything else to do? It's not, the foraging aspect, the interactivity. Does it, also we've seen where even sunlight and getting the bird out a little bit to stimulate the bird. And then also diverse dietary offerings. We've mentioned that over and over again. So basically what you're doing is being interactive with the bird, not necessarily being interactive with the bird, but while the bird's outside, and you want to, of course, be in a protected area where there's no predators, and that it's the weather is conducive to having the bird outside. It's not too hot for the most part, but the stimulus of just being outside and all of the sounds and everything, other birds flying around, that's all helpful. And usually just that, with what you're describing in both wings, that's usually the case, because it's not say a generalized feather loss like involving head feathers or what have you, and feathers over the body that may be more indicative of, say, generalized disease process. I'm not saying it can't be, but what you usually do is think about different, I guess, conditions that would be more conducive to that, and that's somewhat behavioral. Now, when you're talking about the Caique, this is a little bit different in that it's kind of right in the chest, and we did some studies to try to determine with this feather destructive behavior if hypersensitivity to different things within the environment or what the bird ingested would actually cause feather destructive behavior. And similar to, say, a human that gets allergy testing. I'm allergic to this. Am I allergic to grass or dogs? You've heard of dogs. My parents' dog's allergic to grass. Now what do you do? Oh, well, we're going to put in some artificial turf or something. I don't know. So, I mean, that's a problem. And then, of course, people have allergies to pollen and everything else. So, peanut allergy. And so why are birds different? Why should birds be different? Why can't they be? They have the physiology that's very similar to other animals, and it's just that we don't know. It just what we don't know. Don't say, well, birds can't get that. Birds, we don't know. Because the science hasn't been done, no investigations have been done. So we were looking at doing skin testing, similar to what they do in dogs and humans, to see if we could utilize skin testing to try to determine if some of these birds would be allergic and develop sensitivity that may cause this feather destructive behavior. And how this relates to the question is that we found that, and then talking with Dr. Susan Oroz, in discussing this, is that this area, the chest area of the bird, is highly vascular and innervated, and this is maybe a reason that birds will pick this area first over other areas of the body because of the high vascularity and blood vessels and nerves in that area. So this may be an indication, not that the bird has hypersensitivity. We just found that in our study to say, what happened to the study? Well, the study, what happened was that we found that it was not possible. Birds didn't have enough body area to do the sensitivity testing on. But we did find out a lot of information from the study. One, I think that working with pathologists, that birds, I think that people in general at this time have an agreement that birds do get or have a hypersensitivity. At least that's what the pathologists, when they read the slides of bird skin, that they say there's all indications in a cellular manner that are indicative of hypersensitivity in other animals. So what this could mean is that one, that the bird just may one have some sensitivity to food, and you may want to look a little bit about that. It just may be also, as with the other bird, that you need to continue to stimulate the bird, and again, work to make sure that the bird doesn't have issues that would kind of behavior where it would be not stimulated and want to actually and not feather destruct in that area. Now, one thing that I do want to mention, when you have a bird that is picking at a certain area on the body, okay, not necessarily the chest, but any area on the skin, on the leg, one leg, or the wing, or somewhere. If it's one area, then sometimes that can be related, and the feathers around it are affected, that this could be an indication that there may be a tissue mass, an abscess, a granuloma, ingrown feather. So there can be something that the bird is bothered by in that area that needs to be checked out also.
Okay, with that, and so in the case of the 8-year-old female Caique, who has the bald spot under the neck feathers, is that an area that the birds can generally touch, or like if it's under?
If
reach, I mean, the Caique has a bald spot under the neck.
Yeah, the neck. And again, is it totally featherless in that area? And like I said, that's one of the areas that birds will normally go to and it may be associated with that it's a little bit more irritation in that area, not just because it can pick at that area. It could be behavioral. It could be just the start of the bird just picking and preening excessively in this area, so the feathers are fewer in that area. And usually it's 8 years old, and Caiques are fairly interactive, and so they need to have a lot of activity. And if they don't have a lot of activity, then the lack of activity may result in the Caiques having some behavioral issues that would result in the feather destructive behavior. It doesn't have to be a disease process, as we know, but the more interactivity and the more stimulus this bird receives, the better, or the less chance you have, I believe, of developing behavior issues.
Okay. So I have a long, let's see, looks like a involved question from Patricia. So bear with me. This is a paragraph here. It says, hi, I have a female Timneh African Grey, about 9 years old, that in the spring of this year started with a hormonal problem, but has not produced any eggs. She will have her 4th hormone shot next week, but before she started the shots, she shredded her wing feathers. She also shredded her tail feathers, so they are gone. In the past week, she has started to get 2 new tail feathers, and so far has left them alone, but she just started sitting on the floor under her cage for about 2 to 3 hours during the day. At night, she is getting 8 to 9 hours of sleep in a dark room and does not take naps during the day. To help with the problem, I am also trying to reduce her diet of starchy and high protein foods. This has proven difficult, as each list I find for fruits and vegetables is different, to the point almost 80% of them she shouldn't have. Do you have a list of fruits and vegetables that are good for her? And lastly, is it mating season over, or is hormonal problems something she will have all year?
Well, let's put it this way. Let's just say the fruits and vegetables, and then we'll get to the hormonal issue, which is totally unknown, because I'm not sure what hormonal issue is. Let's fruits and nuts and fruits and vegetables. Okay. Fruits and vegetables, as I've mentioned before, as far as fruits are concerned, I'm not aware of any. Well, we've talked about avocado as being something that you shouldn't or wouldn't want to give. The fruits, I don't know of anything that's not problematic. We talked about, well, what about citrus or what have you, and I haven't had any issues with that. The thing about fruits, and you look and you have that apple here, it's basically sugar and water. There's not a lot of nutrition in fruits. It's a dessert, okay, and there's fiber in there, okay, but if you think about it, you're not getting a lot of benefit. There may be vitamin C or one thing that's more than other. You're going to get more of a diverse, I believe, nutritional value from your vegetables. The one thing, if you're giving fresh fruit or vegetables, you need to make sure that the cage is cleaned on a daily basis, if not more, because the fresh fruit and vegetables degrade fairly quickly, and are culture media for bacteria. So if you're committed to that, you have to be committed to actually removing that. But your fruits and vegetables, as it goes, the fruits I would minimize, and think of them as treats, or and if you want to give them, that's what you're looking at. You're not, and so that plays into the part of the behavioral diversity, when you're looking at say, psychologically being a benefit of that, of stimulating the bird. So that's where fruits would have the biggest benefit. They like them. The vegetables, for the most part, there's nothing that I would be aware of. You know, they talked about, you know, some people talk about, say, like sweet potatoes. Should you cook them or feed them raw? And for the most part, I believe that cooking them is a little safer for that on sweet potatoes because of a compound. I can't think of it right off of my head, but if you do feed that. But most of the vegetables that you've known about that are nutritious, your carrots or your, you know, peppers, bell peppers, and different items such as that are good. Okay. Now, as far as your hormonal issue with the gray, I'm not sure where that's coming from. You know, I hear talking about, well, there's feather issues, and so are you considering the feather issues hormonal? I'm not quite sure that there would is necessarily a connection with that, because grays can lay eggs and then not lay eggs. If it was known that grays would always lay eggs like a chicken, then we'd have a lot more grays out there. Okay. But in the most part, just because the bird isn't laying an egg, it doesn't mean that it's a hormonal issue on this. And so I'm not sure what she's being administered to try to overcome the hormonal issue. But I'm not, you know, it's like, we've had grays, African grays, not necessarily Timnehs, but I've had more experience over the years with people with Congos actually. Well, they don't lay, you know, I'm feeding them. I had this owner, I'm feeding all the grays, I'm giving them everything. These were beautiful grays. He sold them, and the people he sold them to, as soon as he sold them, they started laying, you know? And so it's not uncommon for grays that are changing. You know, this isn't necessarily the same for all of the citizen species, parrot species, that they will lay after you move them. But grays, sometimes if there's a change of venue or just moving them around, that stimulates reproductive activity. So I'm not sure really, you know, hormonally, you know, I can't say that I wish I could say, oh yes, feather destructive behavior or something like that is a hormonal issue and that we've had a lot of success. I can't remember giving any type of hormonal treatments to birds and have them like, whoop, they stopped feather destructive behavior.
Huh. So she also wanted to know about the mating season. Is it something? Is this hormonal problem something that'll continue through the whole year, or is there like a set amount of months during the year where you'd anticipate seeing more hormonal behavior?
Yeah, that's a good question. Certain birds have quote unquote mating seasons. Certain birds, the mating season is correlated to the light cycle. Okay, canaries for one. That's not a parrot, but parrots are a little different. But some birds, say like Amazon parrots, have a tendency to mate in the in I'm not saying all Amazon, but many mate in the spring. So it's not that the Amazons aren't necessarily going to lay and mate in the fall. And it's been my experience that they have a window, usually in April to June. I don't know what your thoughts are on that, Laura, if you've seen that in Amazons, but that's just kind of typically what I've seen, which is unusual because you have a macaw, and I know a number of people that they just keep laying eggs all year, cockatiels all the time. Eclectus, it's not something that you see. African Greys, they can lay, you know, I've known birds that have laid at all times of the year. So it's not necessarily related to, and like I said, they could go and lay all year. And then the next thing you know, the owners tell me, must be the weather. The weather's the biggest excuse that bird breeders have of why their bird isn't laying. It's the weather. And I go, yep, it must be the weather. It's either too cold, too hot, not raining a lot, too wet.
Yeah, sounds like Goldilocks. Perfect. The perfect weather. Oh my goodness.
Yeah.
All right. Well, our next question is from Anne, and she asks, "What causes a budgie to vomit, not regurgitate? Sometimes he's just quietly perching, and 3 to 4 seeds slip out of his beak. Less frequently, not every day. It is more violent, shaking his head and seeds flying everywhere, and then he goes and eats more."
Mm-hmm. Mm-hmm. That's an excellent question. And I have a little budgie myself that does that. And I think that for the most part, it is related to possible disease condition, and there's not a lot you can do. And I say a disease condition, you know, they could be more than one disease that could cause that. It could also be behavioral. Birds will regurgitate if there's another bird, or there's a mirror, or there's some type of amorous behavior between you and the bird. But if it's just in the cage, kind of going around, you know, flying around, doing its little budgie thing, you know, tweeting and making all of the feng shui noises that is so nice with budgies as they kind of, you know, live in their habitat, in which I recommend them highly. It kind of gives your environment a nice little background, you know. Over and above, they make great little companions and can talk. There was somebody said that a budgie had 500 word vocabulary. A 500 word vocabulary, like that's you know, that's more than I have, you know. And so, but the thing about the budgie, it's not going to like say, "Hey, I'm over here," you know. It's going to kind of whisper, you know, like, "Hey, you know." It's like a lot of
like your house is possessed.
A lot of people that hear budgies talk are the only people that can understand them. It's the owner.
I just saw a video last night of a budgie doing R2D2 to the teal. It was
yeah, there you go. And it's, you know, so, and somebody say, "You hear it? You hear it?" And they go like, "I hear something," but you know, but nonetheless, so you look at what could cause this, and it's like, one of the things is called avian gastric yeast. Okay, macrorhabdus ornithogaster. How about that? How about that for a name?
Can't spell that.
Yeah, I can barely even pronounce it. Macrorhabdus ornithogaster. And budgies have a tendency to have this and pass this on. And for the most part, it's subclinical, meaning there's no signs that are associated with it. But usually what the condition is it's associated with they call it going light, when the bird goes light. And that's when you feel the keel bone and the muscle in the pectoral area is like pretty much gone, so it'll lose weight. And so these birds can regurgitate, you know, like you described, and can have issues with this organism that's causing an irritation within the GI tract. It's sometimes difficult to diagnose when the bird's alive. You can sometimes culture it. You can sometimes do a little crop swab, and you can get it, culture it, meaning get it kind of a fecal or a cloacal swab, and put it on a microscope and stain it, or the crop, and you can find it there. The problem is it's very difficult to treat, and usually antifungal medications have been utilized over the years to give it your best chance of having some help with that. Also, the little bird could have just a bacterial infection on the crop, an Ingluvitis. The crop is called the Ingluvitis. And so an Ingluvitis, or an inflammation of the crop, that would lead to say the regurgitation when the bird eats. That's what I've, and so you hope that you may have, say, a kind of a crop infection due to bacteria, and then treat it with the appropriate antibiotic. My little budgie, I've been treating with some antibiotics. I need to, the antibiotic, it's still doing that to some extent. So what the next step would be, the antibiotic that I selected wasn't effective. Now, it will not be effective for the gastric yeast, but it may be a bacteria that is not sensitive. The antibiotic is not effective in treating that particular bacteria. That bacteria may be resistant to that antibiotic. And that's why it's so important to, if the antibiotic is not effective, or the bird is in poor condition and you don't have time to wait to see if an antibiotic would be effective, then that's when a culture is important, so that you can actually identify what bacteria is involved and what antibiotic is effective in treating it. And then you have the best chance of getting a treatment response.
Okay, wow. And just real quick, what's the difference? I mean, is there an easy way to tell between a bird that's regurgitating versus one that's vomiting?
Well, that's the an excellent question. And actually I wrote a section in a text one time about avian regurgitation and vomiting. And so the question that you have to first ask, what's the definition of regurgitation, and what's the definition of vomiting? Okay. So what's the difference? And so that's a rhetorical question on this little webinar, okay, to yours. So you ask yourself, what's the difference between regurgitation and vomiting? It's all coming from the GI tract. Well, you know, I feel that the easiest way to determine or define the two is that regurgitation will, and this is not a fast fact, but for definition purposes, that the regurgitation would come from the crop. Okay, so the bird starts doing its little head bobbing, and then it comes out, and it would be crop material. Okay, and that would be regurgitation. Okay, kind of giving back what it just ate, as opposed to vomiting, vomission, which would be from the stomach, coming from
Okay.
farther down in the GI tract that has been digested. You know, I mean, I hate to bring this up, but the smell that you get when you throw up, okay?
Okay.
So it's so, you know, that would be vomiting, and then the little seeds that the bird gets in the mucus, and or even if you're giving nutritional supplementation that is in the crop and the bird does that would be regurgitation, whereas something that is farther down in the GI tract, in the proventriculus, where the hydrochloric acid and you know, that is where you're going to have that occur, if the vomiting occur. Now, you know, you look at birds of prey, you look at you know, your owls, you look at you know, your raptor species, your hawks, and they have the cast that they form of undigestible material. These are little, they're fur, and they have bones in them. You may have heard about those.
Yeah, owl pellets.
Well, huh?
The owl pellets is what.
Yeah, the owl pellets, okay. Well, where do they come from? Well, actually, you would think that if the little mouse went in and it's coming out as a little pellet, that some digestion has occurred, right?
Right.
So, in fact, it has. And these pellets are formed in the muscular stomach. So they actually bring those up in a normal process from their muscular stomach.
Wow.
So it's pretty impressive.
Yeah.
I'm just glad I don't have to do that.
Those would be too big to pass normal.
Yeah.
Oh man. Okay.
So hopefully that helps shed some light on that.
Yes, that gives a good visual.
Yeah, that is a kind of a in birds, regurgitation, vomiting, regurgitation, vomiting. So if you see whole seeds coming up, that's usually regurgitation.
Okay. So our next question comes from Dirk. He was hoping that you could address some of the common suggestions that he sees in first aid groups. So there's three that he had wanted you to address. So one is the use of coconut oil on cuts, cayenne pepper on wounds, as well as on food for pain, and baking soda on food for possible digestive issues.
Okay. The one thing that I would say is that I would say that I think that there are better things out there. I don't know, the necessary need for that, and a cut. We'll start with the first one, coconut oil on a cut. And it was coconut oil, right?
Yeah, coconut oil.
The one thing that I'm looking at is that I'm not gonna, in any of those, I'm not gonna say that it's would cause harm, but what I'm looking at from my perspective is the injury. What is the injury? How bad is the area that you're trying to treat? How severe, how significant is it? A cut could be just a little paper cut. And of course, I've heard about paper cuts having, developing into flesh-eating, people having severe injury from paper cut. And and so, but it could be something that just a small cut or a very deep laceration. And so at what point do you use it? So I'm treating the wound, or the wound should be treated based on the healing process and getting that wound healed as quickly as possible. And so you know, does it need antibiotics? And putting a does it need air? Because if you don't put air, you know, if the cells don't get air, it's going to kind of increase the amount of time that you have in healing. So and if I'm looking at just a small cut, am I looking at doing anything as far as trying to prevent infection in that cut? And of course, anytime you use say herbal, and I'm going to classify this as herbal treatments, usually you're putting and you're looking for one component, or you're looking for as opposed to the entire substance working on that, or the product that you're using will provide an environment that would be conducive to healing. So that's all considerations, because it's something, and so somebody's recommending we'll put coconut oil on there, and I'm going, you know, I'm saying, well, there's other products. One, if you want something non-toxic on a wound that's healing, we have and we have all different products, because wounds are one of the most common presentations we have with birds. It's one of the most common, and I mean, all different types of birds, dog bites, other birds. Yeah, I can just, you know, going and predator attacks. So these are all very common presentations, and from not very severe to very severe. And so when we have something that's somewhat, I would say, kind of a minor wound, a flesh wound or what have you, of course we clean it, and then we'll use something as innocuous as a product called VetAid spray or foam, and it's actually ionized sea salt within that to reduce the inflammation, and also provide an environment for that wound to heal. And it's not oil. Anytime you put oil on a wound, that kind of reduces the ability of the cells to breathe, and so you're reducing the oxygenation to those cells. That's why we put preparation H on wounds, on surface wounds. Preparation H had a compound in it called live yeast cell derivative, and this live yeast cell derivative helped increase the oxygenation of the tissue in which it had contact. And so with increased oxygenation, and then you're going to have an increased healing. That's one of the things that you know, you have hyperbaric oxygen chambers for wounds that are difficult to heal. So this is something that I think that there are better products out there, you know, and we'll use honey. We'll use honey quite a bit in wound, but it's the product that we're using to increase the chance for healing by affecting the entire environment of the wound. So But oil may, make the skin supple. But as far as I think that, and I don't know if that it'll necessarily do harm. Well, obviously people are recommending it, so they've used it. But I think that there may be better products out there than that. What was the next one?
Cayenne pepper. Or
Cayenne pepper on.
Cayenne pepper. See, you're from Louisiana.
Yeah, c'est bon. So what was the
For
cayenne?
wound, for both wounds and for I guess to sprinkle on food for pain.
Sprinkle on wound. I would to cause pain or to relieve pain.
For pain, it's true. It says as well as on food for pain. If it was me, it'd be painful because I
Who
can't.
asked the question? Who asked?
That was from Dirk. I want to know
Yeah,
about the.
well, I couldn't pass that up, Dirk. I had to say. No, I don't think that I would say. One of the things that you always have to think about when you are, as far as wounds, like I said, I think that there are better products out there. And as far as putting on food for pain, the one thing that we always try to do is provide medication at a dose that targets what we are treating. And so, and then also what you have to look at is what the compound that's going to actually reduce that pain that's in cayenne pepper, which is why you're feeding it. And also, is that compound within that food you're feeding going to be absorbed into the body, okay, at a level that will actually reduce pain, okay? And a lot of times compounds that are effective in this manner, there are many drugs that we, CBD, for instance, we've been doing to try to get a therapeutic level of CBD, speaking of pain and in birds. And what we found is that using CBD in hemp oil was at a very high dose, was we had irregular absorption at therapeutic levels that people have deemed appropriate for treatment. So there are many drugs that we can take as mammals that birds and different bird species just do not absorb in their digestive system, okay? So it's unknown exactly what compound, I don't know, it may be known, what compound that they're trying, that's effective in treating pain, but nobody that I'm aware of has done any pharmacokinetic studies in administering this to birds to even see if there's anything absorbed. So I think that often it's almost like a placebo type effect, and while I'm giving it, the bird looks better, so it must be good, when actually nothing's being absorbed. So there's to me at this point, I don't see any evidence that would be effective in treating pain. And the third.
Okay. And what about baking soda on food for possible digestive issues?
I mean, I guess that goes into the thing, baking soda, apple cider vinegar. I think we had something like that at one time, a question. It's a good question. People bring that up. And then the digestive issues, I think that for one, you have to think about what the digestive issues are and try to target that. I haven't in my years of, I could just say, and I hate to admit it, but it's true. So the truth hurts. So in about the 34 years that I've been practicing, I don't recall that I've had a digestive issue that I've seen in birds, and I've been treating a lot of birds over the years, that baking soda would have been effective. Okay.
Okay.
And then you look at, well, if you have a digestive issue, what is the digestive issue? Is the digestive issue a proventricular adenocarcinoma, which is stomach cancer? Baking soda wouldn't help that. And so if you're treating, and we have birds with crop issues, just had one of my research parrots have a kind of a crop stasis, slow moving crop. And so we've had one of my research, I'm just thinking of severe bacterial infection. And so baking soda, as far as treating digestive issues, I would say that I wouldn't, that wouldn't be a recommendation for mine. If you had a digestive issue, you need to try to figure out what it is, and then treat it appropriately. If you could, like I said, if it's stomach cancer, there's not much you can do.
Wow. Okay. Oh, and just I was waiting for another question. Just going back to the guy, like the pepper. Is it true? Like, don't parrots have their receptors? They can handle a lot hotter, like peppers and stuff that might cause us to, be uncomfortable.
Well, that's I think that's the general thought out there. In so much as that I know that it's been recommended, if you have squirrels in your bird feeder, to put cayenne pepper in your bird feeder, yeah, to try, and that will help. Gray squirrels are pretty, huh?
That's a great tip.
Yeah, but they are, gray squirrels, they'll go through just about anything, but I think it gives them pause for thought.
Oh man, that's a good tip. All right. On that, I have a question from Hansy. I have a parakeet who was puffing up and not playing or making noise, but eating well. She got an extended belly. She has an extended belly, which the vet thought was either a mass or an egg that was stuck. And the vet put her on 14 days of antibiotic and 7 days of painkiller. And that was about a month ago. And now she's fine. The belly is normal and she's playing and singing with the other one in the cage. Question is, how likely is it for it to happen again?
Well, I think the first thing, we don't know what it was. Okay. And so really we need to know what it was for it to happen again. Whenever you have a budgie that has a distended belly, let's just for that, you have to think of what could possibly cause that. And now from what I'm to gather from the question, that it was a female.
Mm-hmm.
And so I don't know if she's laid eggs before or not, if there was other birds in the cage or not, or if it was even set up for breeding. But let's just put it this way: if she had a distended belly, that if it was a tumor, which could cause that in budgies, say a liver tumor, that it would not have resolved. So you can pretty much, that would, for the most part, you can take that out. Okay. So then you say, well, what could have caused that? You can look and say, well, it was an infection that may have caused it. I don't know. I think, did you say that the bird continued to eat, Laura? Did the bird
Um,
continue to eat when it had the distended?
yeah, eating well. Yeah, it wasn't playing or making noise, but it was eating well.
Mm-hmm. So the yeah, I agree with the comment there too. And but that's why it would be, you think, well, the antibiotics and the pain medication. Well, the pain medication is an anti-inflammatory, and so if anything, you look at what could have caused this, it may have been some type of an internal ovulation, where the bird may have ovulated the egg and caused some inflammation within the general body cavity. So like an ectopic pregnancy, for instance, instead of the egg going down the oviduct, the egg went into the body, the yolk, so to speak. And this could have caused some inflammation, and that inflammation caused fluid, and then the fluid is what caused the distension. That in and of itself would explain why the bird didn't feel well, but continued to eat. It didn't have like a GI problem. And then if you look at antibiotics, usually it's not an infection that causes that, but it's an inflammation. And although the bird is immunosuppressed, so the antibiotics didn't hurt, probably the most likely, I guess, consideration here for what was most effective was the pain medication, which is probably an anti-inflammatory. And the bird recovered and resorbed the fluid. Could that happen again? Yes, that could happen again if all the scenario plays out in a similar fashion. But at least it doesn't appear that it's cancer, which is one of the other considerations why the bird would not feel well, but still eat and in general be like that.
Okay. Wow. And yeah, I was laughing at the comment too from Karen. She said that she tried the cayenne pepper in the bird feeder outdoors, and the squirrels seemed to consider it an excellent condiment. So,
Yeah, and I would say I've tried this because it was somewhat frustrating for me. And the more cayenne pepper that you put, it gives them a little bit more of a challenge. But they, like I said, gray squirrels, they are pretty industrious creatures, and they will sacrifice their eyes to eat those seeds. I'm telling you.
That's so funny. Okay, so all right, so I have to announce our winner for today, who's going to receive the tropical fruit pellets and another Lafeber bag of your choice, and that is Judy M. So congratulations, Judy. So on Monday you should be getting an email from Lafeber company to send that out to you. So yay, we got a winner today. Congratulations, Judy. Hope that makes your weekend. And just real quick, next Friday we are going to be back with Dr. Stephanie Lamb. She's going to cover the topic of avian emergency care, and she's going to tell us on what to stock up in an avian first aid kit. So something to look forward to. Yeah, so that'll help make your life easier when people have their first aid kits all stocked up and they can handle some things at home. So.
Yes, well, yes, and the bird is thankful too.
Yes, and the bird is thankful. Of course, was thankful. Okay, so Dr. Tully, again, that was so fun. Thank you for walking us through some. Well, I mean, the conditions and stuff, those are serious, but the other stuff is fun. But thank you for walking us through the feather issues and the mass inside the budgie and all that stuff. And that was good information to have. So,
well, it's good questions, and we can't do it without the questions. So keep bringing the questions. Really enjoy it, and they lead to other items that we discuss. But really appreciate everything you do, Laura. yeah, good moderator. Excellent.
Thank you. I learned a lot. So, wow. Well, okay. So on that note, it is Friday the 13th, so everyone be safe this weekend, especially if you're superstitious. But so anyway, just want to say thank you again, and I want to wish everybody all the best to you and your flock until the next time we meet up, which hopefully will be soon with Dr. Tully. So thank you guys. Thanks for joining.
Thank you. Y'all have a great.
Bye. Have a great weekend.
Bye-bye.
Bye.